Good afternoon. Today, as always, very interesting information. Top 5 striking images that show COVID-19's impact on the world. One of the all the more fascinating effects of the Chinese coronavirus COVID-19 on the world, where pictures are concerned, isn't so much what we see, as what we don't see. While individuals have sequestered themselves inside their homes, the world has gone generally quiet and void. 1. As the United States government started to take the approaching risk of COVID-19 truly, it became evident that individual defensive gear and ventilators would have been hard to come by. Accounts of government stores containing a huge number of unusable ventilators because of upkeep contract lapses and alerts by authorities to confine PPE to individuals who were showing side effects started springing up everywhere throughout the internet. Governors were set to offer against each other for hardware from providers, and some emergency clinic laborers had to reuse covers for as long as 7 days at a time. Supplies were an issue. However, a few nations that weren't at first hit as hard as the United States did what they could to help. Russia filled a plane with provisions and sent them to the United States, which brought about this photo that coursed online for a considerable length of time. The airplane was sent to the States following a one-on-one phone call between both countries' pioneers. President Putin made the motion with the thought that should the US see a drop in cases while Russia winds up managing an ascent, the States will respond if need be. 2. A term hardly any individuals outside of the human services industry heard before the emergency, N95, has become one nearly everybody around the globe presently knows. N95 bales are strong expendable covers fit for halting the spread of COVID-19 and numerous other airborne pathogens, which is one reason they immediately got essential for the world's medicinal services laborers. Lamentably, they got increasingly hard to track down as the infection spread, which is the reason such a large number of specialists and medical caretakers wound up reusing them for any longer than they regularly would have. Supply gives aside, N95 covers function admirably in light of the fact that they sit cozily on the face, and aren't the most agreeable things to wear for broadened time frames. During the time of March, individuals started sharing photographs of what they resembled in the wake of working for quite a long time and days while wearing the covers. Appearances wounded around the eyes and mouth turned into a typical sight as increasingly more human services laborers participate with their own shots. The photographs don't simply show wounded and tired individuals, they show the people chipping away at the cutting edges to battle the malady, huge numbers of whom worked for a long 12, 18, and 24-hour shifts. 3. During a pandemic where governments are advising the entirety of their residents to self-confine themselves in their homes, it immediately became clear that there was a sizable populace that couldn't follow that direction. The destitute are at more serious danger of getting the malady. Yet that is not exclusively the consequence of their dozing outside, it's generally because of their nearness with each other. Regardless of whether they are in the city or in covers, vagrants regularly wind up stacked intimately with each other, and that makes them helpless to COVID-19. And it additionally makes it almost certain that they will taint others. Exponential disease is perhaps the best concern where COVID-19 is concerned, and in urban areas like Las Vegas. The manner in which the city has needed to manage it made universal news. Asylums had to close in the midst of the emergency, leaving upwards of 500 in the city. The city painted lattices on the upper parking garage of the Cashman Center, with each case being implied as a spot for one individual each to rest. Lamentably, all honest goals being what they are, Individuals online called attention to that the squares were excessively near one another, invalidating the requirement for social removing, which further spread the picture to others as it got viral. 4. Clinic beds, or all the more precisely, the absence of emergency clinic beds turned into an issue soon after COVID-19 arrived at the United States. It bodes well, as clinics aren't in the matter of taking care of a worldwide scourge, they're there to treat and care for patients under typical working conditions. That works fine and dandy when the world isn't experiencing a pandemic, however in urban communities like New York City and Los Angeles, a lack of medical clinic beds because of the convergence of COVID-19 patients caused two particular problems. There weren't sufficient beds for COVID-19 patients, and there were basically no beds accessible to individuals experiencing everything else. Individuals requiring medical procedure, chemo treatment, and each other issue people go to the emergency clinic for were running into an absence of limit in treating them. To battle the issue, the USN sent two ships, the USNS Comfort and USNS Mercy, to New York City and Los Angeles, individually. The two vessels were intended to facilitate the wait by giving 1,000 clinic beds to patients not experiencing COVID-19. However, since they have shown up, the USNS Comfort has taken on patients experiencing the disease. Shots like this one demonstrating the Statue of Liberty in the frontal area of the USNS Comfort spread everywhere throughout the internet as it moved toward the port. The appearance demonstrated a demonstration of help and an indication of expectation in the days to come. 5. One scene nobody wants to be reminded of when thinking back on this crisis years from now is any that shows the toll the virus has taken on the people. Some of the hardest hit cities quickly learned that there wasn't just going to be a lack of hospital beds for the sick, there was also going to be a burden on morgues, coroners, and morticians. Everyone was so focused on the need for ventilators and hospital beds, few thought of what to do when the bodies began piling up. Fortunately, there were some who planned ahead. And that brings us to the picture featured here. This shot, taken by John Minchillo, shows bodies being loaded into refrigerated trucks outside a New York City hospital. NYC was one of the hardest hit American cities in the early days of the crisis, and its hospitals quickly reached capacity on a number of services, which include the storage of the dead. The Brooklyn Hospital is one of many that have turned to such measures to store bodies, and the city has many. By April 8, more than 4,000 people died in New York City alone. Subscribe to the channel and click on the bell. See you soon, and don't be sick.